Few days ago, in one of my Facebook posts, someone commented a picture of her and said that I always have red cheeks. Please help me out. What is this? Immediately, someone else replied, "Oh, you don't worry, it's rosacea." Boggles my mind that how many times someone sees a red cheek and immediately thinks it's rosacea. Let me tell you, if you have red cheeks, most of the time in normal skin, it's just damage barrier. So why do I think it's a damage barrier? The skin around your cheeks are very, very thin and more vascular. What I mean by vascular is that the blood vessels are closer to the surface. So if you over exfoliate, if you damage your skin due to extreme sun exposure, your cheeks, because the skin is thinner there and the blood vessels are closer to surface, they are very, very prone to show the reaction. So what happens if you don't fix your damage barrier? The constant exposure to triggers weakens the barrier more. As a result, the blood vessels, which are closer to the surface, dilate and redness becomes constant. It's not always rosacea. Sometimes when you are at the advanced stage of skin damage or barrier damage, the damage shows through your cheeks, and that's why your cheeks are red, not because you have rosacea. When you have a damaged barrier, the cheeks, they are red, they are not warm, they are dry, and they're tingling whenever you are cleansing them. And also they're constantly red, not triggered by spicy food, alcohol, or anything else like winds or weather. So what happens, like when you have rosacea and if you take spicy food, if you take alcohol, the cheeks get red. But in case of damage barrier, you don't have this. It's constantly red all the time, and it gets more red when you cleanse it or if you put like acids on it. How do we fix it? First of all, you have to change your moisturizer and choose something that has clinical grade cholesterol, ceramide, and fatty acid proportion. So it should be 3 ceramide is to 1 fatty acid is to 1 cholesterol. So that's why you have to make sure that you are using a moisturizer that has clinical grade ceramide, cholesterol, fatty acid proportions, and it is nourishing. One of those moisturizer is the P Kato moisturizer. I use this one. It's a Korean moisturizer. It's great. It's excellent, and it heals the barrier very quick. So you can try that one as well. There is another one from Avene. That one is very good as well. So you can use that one too. Second is that you have to minimize the exfoliation for at least few weeks. So whenever you are healing your barrier, you can use gentle exfoliating agents like lactic acid, or you can use glycolic acid, but very low, like 1 or 2% glycolic acid if possible. The max you can go is 3%. So you have to reduce the amount of acids or exfoliating agents you're putting on your face. Third one is you can use sheet mask. I am a big fan of sheet mask, and if you have damage barrier, they help a lot. So first, a good moisturizer. Second, limit your acids. And third, a good sheet mask at least 3 times a week when you have the damage barrier. Once it gets healed, you can go for 1 sheet mask in a week, but until it gets a bit better, you should be using at least 3 sheet masks in a week, and you will see some improvements. I swear you will see some improvements at least in a month. Moral of the story, not all redness on your cheeks mean it's rosacea. Sometimes it's just damage barrier. And you should not be panicking that, oh my God, I have red cheeks means that I have rosacea. Now I have to go to a doctor. I have to limit my food. No, it's not always like that. In most cases, it's the damage barrier. However, if you suspect that you have rosacea, always do visit a professional, always visit a doctor and take their guidance to heal that one. Do not try to treat rosacea at home because that's a chronic skin condition. I hope you learned something new. I hope you learned something new. I'll see you on my next video. Until then, ciao.